want me to turn it off?
No, it's all right. Hey guys, it's Pat. In the middle of coaching a class. That's all right. We're gonna talk about his back. I always need to look into the camera here. So we're talking about his back pain, and we're gonna look at this board together. So there he is, little Pat, 30-year-old CrossFit coach. Sorry for the glare. All right, so up here dealing with some neck, shoulder, left-sided pain, significant. He gets some C8 tingling in his pinky ring fingers, ties into the C8 nerve root, coming from the neck, disc bulges going on, possibly, not diagnosing anything. He calls it a 6.5 out of 10 pain. Also some sciatica on that left side. Right now traveling to the thigh, every now and then down to the calf. Somewhat piriformis-ish. Calls that a 4 out of 10 pain. He gets some pain with toes to bar, into that extension, the kipping. Some burpees when he's kicking out again. That's going from a flex position to an extended position. So that causes him some issues. So, again, 7 years ago, doing some CrossFit deadlifts. Got some bulges, slip discs, L4, 5, S1. Also up in the thoracic spine, mountain biking 5 years ago. So that's history that we're looking at. Trying to make sure we figure this out. So McKenzie going on. So it's a diagnostic system. I wanted to bring this up. It's not, some people use this as a main diagnosis and then treatment. Sometimes that's a little too simplistic for me. Sometimes it works. I think the general, what I've seen in the field of physical therapy, it's going away from that. So one thing though is Dr. Google, there's some intricacies that get missed. So Pat's a pretty smart dude. As we talk about his case a little bit, we'll do a few videos. He went down that, he did come across McKenzie in the rabbit hole, and if you do that, most people focus on the fact that, again, going into prone extensions on the floor, going into these extensions is what it's all about and what will fix you. But the reality of it is a diagnostic system. So you should be doing some different assessments. So for him, as I did that assessment, his flexion going down, touching his toes is what actually made him feel better. He also got better spinal motion out of that. So that really helped his, again, toe touch. It helped his symptoms. Based on that, I would say, one of my prescriptions becomes go down, touch your toes frequently. Maybe we need to even build off of that in some other ways. There's some posterior tension. Again, we'll figure out how that all fits in. There's some other really interesting stuff down the line, but I'm going to cut this video right now. But I did want to point out that when you go on the Googles, it doesn't always win, or it doesn't always clarify exactly what you need as an individual. In fact, it's pretty much the opposite of what he needed, what he saw about McKenzie. So again, be very careful with Dr. Google versus actually talking to a clinician who's dealt with thousands of cases and seen and able to tell you that, nope, that's actually the wrong thing. If you really want to get out of pain or start working in the right direction, we need to fix you. So his extension, again, didn't really help, made it a little bit worse on the McKenzie side. Side bending, which is just kind of just bringing your hip over to the side. So going to the right for him made it worse on the left. Going to the left might have been decompressing a little, kind of stayed the same, not necessarily something that we need to build off of according to the McKenzie system as I understand it. If it's same or better, you can keep doing it. So to the left side bend, maybe there is something there. I'm going to cut it here. It's a pretty long video. We'll talk more about Coach Pat from Mission CrossFit a little later.